Today's lecture is Chapter 8 out of the 13th edition of Ken's The Medical Assistant, and we're going to talk about telephone techniques. The telephone is the lifeline of a medical practice, and we are to treat all phone calls with respect and courtesy. Most of our phone calls are going to come from established patients, new patients, reports of treatment results or emergencies, physician referrals, lab results, and pharmacy and patients for prescription refills. Familiarity with a multiple line telephone system is a must for the medical assistant, and even the smallest of healthcare facilities typically has at least 2 telephone lines. This is going to allow you to transfer calls and possibly set up conference calls, and has a button for each line. Figure 8.2 shows a telephone with numerous call buttons on it. Headsets are going to improve your ergonomics and improve your neck strain. It's a combination earphone and microphone, and you can typically adjust the volume in the earpiece. You can also mute the caller at your headpiece so that they can't hear you speak. These phones are going to have the speakerphone, which allows you to hear and speak to the caller without using the handset or headset. Conference calls, where multiple people can call in from different locations. Caller ID allows the user to see who's calling before he or she picks up the phone. Voicemail, of course, is widely used in today's business office because it affords an around-the-clock method for receiving patient messages. Then the intercom allows for two-way communication without requiring you to pick up the handset or use a headset. The hold button allows you to interrupt a call momentarily, and then speed dialing allows you to program keys on the telephone pad to automatically call a stored telephone number just by pressing one key. Telephones should be available in the lab and the clinical area, and multiple phones should be present in the reception and business office areas. Typically, there will be 2 incoming lines along with a private outgoing line with a separate number. One medical assistant can handle no more than 2 incoming lines, and telephones should be placed where they're accessible but private. We've already talked about some principles of active listening. Active listening involves listening to what the speaker is saying, interpreting what the message is, and then restating the message to make sure that you have received the intended message. You have to be present in the moment and focus solely on that conversation. Don't interrupt, and don't start forming your response before the person has finished speaking. Confirm what the speaker has said and ask if your interpretation is correct, and always be respectful and professional. Never answer the telephone while eating, drinking, or chewing gum. Give the caller your full attention and present a professional, friendly image of the office. Avoid speaking in monotone. That's using a flat effect. Your voice never raises, your pitch never changes. Make sure that you enunciate clearly. Your diction, pitch, and clarity are on point. Use a pleasant voice. Try to sound friendly. Try to sound warm. Avoid using medical jargon. Don't speak in medical terms that your patient doesn't understand, and do use correct grammar. Before you place a call, have all your necessary information ready and have a pen and a pad ready to take notes. If you need to, write down a list of questions or goals for the conversation, and then keep a list of frequently called numbers handy, and that'll save you time. Be careful when using a speakerphone, because we've talked about over and over and over that maintaining confidentiality is an absolute must in a healthcare facility. If patient-sensitive information needs to be discussed, place the call in an area where others cannot hear, and the sound of a speakerphone travels much further than you might think, so be careful when using a speakerphone. When the phone is ringing, answer it quickly, always by the 3rd ring. When multiple lines are ringing in at the same time, place the first call on hold long enough to ask the second caller to hold. If it's an emergency, let others on hold know they may have to wait or be called back. Do not multitask when on a phone call. If the call is an emergency, prompt attention to it could save your patient's life, so you must know how to activate EMS in your area. Identify the facility first, then say your name, and then choose a greeting and practice saying it. If the caller does not identify themselves, ask who is calling and then write down the name immediately. Try to use the caller's name at least 3 times during the conversation, and then handle callers who will not identify themselves according to office policy. Unidentified callers could be a patient, therefore every attempt to identify the patient and assist him or her should be made. But such callers, such as salespersons who are fully aware that if their identity is revealed, they'll never get the opportunity to speak to the physician, can cause trouble. So just make sure that you follow your office policy on that. When we're screening incoming calls, you have to know your physician or your provider's preferences. Do they prefer to have calls go through? Do they want to return them later? And then make sure you explain to the caller what will happen based on the physician's preferences. Provide an approximate time frame for when the caller might expect a call back, and then make sure you've got the correct phone number. Read that number back to the patient. So some questions to ask are, what phone number can you be reached at? Where are you located? What are your chief symptoms? When did they start? Has this ever happened before? Are you alone, or do you have transportation? These questions can be asked when handling an emergency call as well to help you decide what route you need to take to get the patient the best care possible. If the provider is unavailable for only part of a day, take a message and inform the caller that the provider currently is out of the office but will return calls when she or he returns. Screening calls is an important task for medical assistants who answer the phone. Then as the medical assistant gains experience and knows the provider better, he or she will begin to have a sense of the questions the provider will have. But remember, just always be patient with the patients. Be careful when you're placing callers on hold. Do it for as short of a time as possible, and once per minute check back in with the patient that might be holding. Offer to have the call returned rather than wait on hold, and then always thank the caller for waiting. Requests that might require pulling the patient's chart from the files are best handled with a call back to the patient. And remember that leaving a patient on hold not only ties up the physician's phone lines, it could also be preventing an emergency call to come through or new patients that might be attempting to call. And plus, it's going to aggravate the patient that you're keeping on hold forever. When we're transferring a call, always ask permission of the caller. Is it okay if I put you on hold for a moment and then transfer your call? Identify the caller to the person receiving the transferred call. Make sure the person that's getting the call understands who's calling. If they're unavailable, ask the caller if he or she would prefer to leave a voicemail or take a message. And then know how to direct calls to the appropriate staff. You don't want to send someone to the insurance department that has a question about a lab. When we take messages, never use small scraps of paper or sticky pads, anything like that, because they're too easily lost. You need to use impression-sensitive message pads. They provide a copy of each page, and that ensures that no message is forgotten, and it's also the best way to keep track of handwritten messages. There's many electronic software systems now that will populate the name, address, phone number, date, and time of the message. Therefore, all you really need to type in is the reason for the call and what the patient would like the physician to do. But in that case, also verify that their phone number has not changed since the last time they updated in the system. There are figures 8.4 and 8.5 that show phone message pads. Do not trust memory messages that were not attended to from previous days. Always carry them forward either electronically or in writing. Message procedure is incomplete until the necessary action is taken. And then add a notation to carry it over to the next day if necessary. And then you also want to note the patient's attitudes if significant to help the physician when returning a call. Make sure accurate telephone records are kept to ensure good patient care and customer service. The office should have a policy on retention of message records, and then electronic systems should send directly to the medical record. Keep the handwritten message pads for a period of your statute of limitations. Requests for directions. You want to make sure that these directions to the facility are close to the telephone so that employees have easy access to them. Make sure that they are clear, they are printed out, they are easy to read, and that they can be given to patients. Make sure that they've got various points on the area too, if you're coming from the north, if you're coming from the south, if you're coming from the east or the west. And don't simply suggest that the patient refer to an internet map. Offer to give them play-by-play directions to your facility. Patients call often about bill inquiries. If a patient calls with a billing question, obtain the ledger from the computer or the files. And if the inquiry is routine, ask if you can help answer the question. You can arrange payment plans and then note the call in the medical record, but then make sure to refer them to billing if necessary, or if the question is going to take up a tremendous amount of time and possibly research. If fees are regularly discussed on the telephone, you need to write a suggested script in the policy manual. A lot of patients want to know how much things are, and so we will have to give estimates of fees before patients see the physician. But you want to make sure you follow this by stating that fees vary depending on the patient's condition and test ordered, and then have a schedule of the fees available to look at for reference. Insurance benefits vary for participating and non-participating providers, and a claim will be denied or reimbursed less if the physician is not a provider for that patient's insurance company. Patients call often to inquire whether a physician is participating provider with their insurance plan or managed care organization. So it's helpful to keep an updated list of valid plans by phone, but it is ultimately the patient's responsibility to call their insurance company and verify that that physician is a provider in their network. Insurance is a difficult subject to understand, even for trained individuals familiar with the various forms and procedures. So patients may call to inquire about a claim status or if their insurance was filed. So try to answer those inquiries patiently, provide help, and don't hesitate to refer them to the billing department if necessary. Radiology and lab reports are often faxed or telephoned or emailed to the physician's office. You want to make sure that these reports are relayed to the physician, and if they're marked stat, the physician wants those results immediately. A physician may also ask a patient to report on a condition a few days after the visit. So take these calls and relay the information to the physician if the report is satisfactory. If the patient's calling and saying, "I feel great on this new medicine," let the doctor know, then that's wonderful. But if the patient is calling and they're unsatisfactory or they're not improved, you want to immediately inform that physician so that he can take action. Make sure you've got a correct phone number and the correct pharmacy when you're following up with these patients. Routine reports come from hospitals and other sources. Hospitals, different clinics may call just to report on a patient's progress. Just take the message carefully and give it to the physician. Requests for referrals come in often, so handle these as quickly as possible so that the patient may make an appointment to see the referral physician. Referrals may be handled without consulting the physician if a list of referral practitioners is provided. If the insurance plan requires a written referral, then the physician must handle that. And most physicians will require an office visit to discuss the referral, and then you'll call the referral physician and notify them of the referral. Make sure that you document all referrals in the medical record. Calls may not refer to patients if it is an office administration matter. Accountants, auditors, office suppliers, office maintenance, etc. That should have absolutely nothing to do with your patient or your patient care, and these calls should be handled and referred to the appropriate person. For many of these calls, you'll simply need to gather additional information and then have the call returned. Now, some patients are going to call and refuse to tell you what's going on. They may have some symptoms that they don't want to discuss over the phone. If the patient refuses to discuss the symptoms, then suggest that he or she make an appointment to discuss it in person. The physician cannot be expected to take numerous phone calls from patients who do not want to speak to the medical assistant or who won't share their complaints with someone. If a patient calls in with an unsatisfactory progress report, do not give medical advice to the patients. Make detailed notes about the patient's unsatisfactory progress and make sure the physician gets those notes. Follow up with the patient with the physician's instructions. The physician may wish to make a medication change, or he may want to see the patient back in the office. Requests for test results can be difficult as patients do not always understand that the medical assistant does not have the privilege of giving out information without the permission of the physician. And if the result is unfavorable, the physician should certainly be the one to inform the patient and give further instructions. If the result is unfavorable, make sure that you are looking at some time, that you've already kind of looked at the appointment schedule, and make sure that you've kind of got an idea of your head of when you can offer this to the patient. Make sure that the patient's identified properly, and then make sure that if you're given any information to a third-party caller, that you have got the appropriate written permissions before you do that. Patients are also going to call and complain about their care or their fees. When patients call angry, one of the most helpful things that you can do is say to that patient, "I'm going to help you," or "Let me help you." Listen to the patient. Reassure that patient that you want to help. If they're having questions about their bill, explain the charges. Offer to pull the chart. Research the problem. Discuss it with the patient. You may be unable to appease the patient, and if that's the case, you may have to let the physician or the office manager talk to that patient to try to explain. Emergency calls could be coming through and lines need to be clear. That's why it's important that we're cautious about calls from staff members, families, or friends. If personal calls come to the physician, you're going to handle those according to the physician's instructions and be tactful. If personal calls are coming into staff, only take personal calls in case of an emergency. When angry callers call you, you're going to have to take action. It's going to be important that acknowledge that patient's anger and reassure them that you are there to help them. Lower your tone of voice and volume. That's going to encourage a calm manner. The softer you talk, as a general rule, the softer your patient will eventually start talking. If you get angry, they're going to get even angrier. Try to get to the root of the real problem and express genuine interest. Take careful notes and follow through. Never pass the buck by saying that isn't my job or I'm not the person who filed that insurance claim. It's best when you're dealing with an angry patient to actually not transfer them anywhere, because they're going to feel like they're just passed along and that you're not taking their complaints seriously. Aggressive callers call in and they insist that they receive whatever action they feel is necessary immediately. Reassure the caller that their concern is valid and will receive the full attention of the right person. But do not let aggression force you to take inappropriate action or say something that perhaps isn't true or isn't correct and that you can't take back. Explain when the caller can expect a response from the office and then follow up that appropriate action was taken. A lot of unauthorized inquiry and sales calls will come in. Callers requesting information to which they are not entitled should be politely denied. Keep your sales calls quick and know which companies and reps your office works with. Developing a good rapport with the reps from the companies whose products are frequently used in the practice may result in discounted prices and first news of sales and promotions. If callers call in with difficulty communicating, you're going to really have to use your listening skills to try to understand. Ask questions to be sure that you understand what they're saying. And if a certain language is predominant in the area, the physician should consider hiring a medical assistant who is bilingual. Many of the practices now will have a dedicated interpreter line. Make sure that you're using that line. Typical outgoing calls, most are responses to your incoming calls. Someone's called in with a question, you're calling them back to give them information. So plan those outgoing calls in advance. Organize your calls to increase efficiency. If you've got 4 prescriptions to call into the same pharmacy, make that call all at one time. And remember to treat whomever you're talking to on the other end of the phone as as if you would want to be talked to. Be cognizant of our time zones. It's important to keep in mind that the United States is divided into 4 time zones: the Pacific, the Mountain, the Central, and the Eastern time. If you're trying to get information from an insurance company, make sure you're calling when someone will be available to answer the questions. It's hard to hold someone accountable for not being at work if you're calling them at 4 a.m. their time. Figure 8.6 shows your different time zones across the United States. Long-distance calling, of course, is an efficient way to get information quickly, and directory assistance can provide some numbers. In some areas, you use the 411, but internet searches are a free way to obtain those numbers. Often, a fee is charged for using directory assistance, so look for the phone number using whatever free sources are possible. You're responsible for helping be a good steward of your practice's money. If you reach a long-distance number and it's wrong, be sure to obtain the name of the city and state that was called and report this information promptly to the local operator so that the facility will not be charged for the call. Internet services like Skype allow the user to call long distance through a computer with no long-distance charges. Using a telephone directory, a lot of people have never used a paper directory anymore because everything's so accessible on the internet. But the primary purpose of your telephone directory is to provide lists of those who have telephones, their telephone numbers, and in most cases their addresses. You can also use the telephone directory to aid in the spelling of names and in locating certain businesses. You're going to have your introductory pages, your alphabetic pages, which is your your white pages, and then your yellow pages. Answering services are very good. They're very practical. They're very needed. Patients expect to be able to contact their provider if an emergency arises. And after office hours, most healthcare facilities use an answering service or a machine. With an answering service, an actual person answers the call, which can be comforting for patients. By following the criteria given to them by the healthcare facility, patients can determine whether the provider or on-call person should be contacted or the patient directed to the hospital emergency department, or whether a message can be taken and relayed to the healthcare facility in the morning. An automatic call routing, or sometimes called a phone tree, can be very frustrating for patients. They're given a menu of choices, and it can be an efficient way to handle a large volume of calls. Patient education. Recordings that offer health information can be played while the patient waits on hold, and messages about special events can be announced. Phone directories can offer listings of health information. Such features help address the needs of today's more information-oriented healthcare consumers who are interested in healthy lifestyles and gaining useful information immediately. Our legal and ethical issues, of course, are that we take care that no one overhears sensitive information while on the phone. We do not place or receive personal phone calls during work hours. Our telephone and message records may be brought into court as evidence, so make sure all messages are complete and legible. The telephone is a business line and should be reserved for patients and others conducting business with the office.